All right. Thank you. Welcome everybody for coming here, and thank you for coming on a Saturday morning with a bright sun to come listen to the speech of workers that are too often invincibilized, especially in this extraordinary situation that is the COVID-19 pandemic. Today we have the opportunity to speak to multiple people that will explain their reality, but before that we'll have a few technical remarks. We have Croteau, which is myself. I'm a member of Socialist Alternative, which I am doing the simultaneous translation. So under your screen, well, if you're already listening to me, I'm assuming that you know how to get the translation. So I'm just going to let her explain that part.
So for people who speak English,
there we go.
There will be translation. At the bottom of your screen, you should see an icon where it's written interpretation or translation maybe. If you click on it, you should be able to select the English channel.
And if you're on the English channel, then you're supposed to be able to listen to my voice. If you have any issues with this, you can indicate it through the chat.
Use the chat to contact us and we will help you.
Yeah, so if you can't hear me, well, here we are. Considering there's a simultaneous translation, the panelists and myself, Chantal, will try not to speak too quickly to let Simon do the translation correctly as humanly possible. All right, so without any more pausing, we can start. Let's introduce a panelist as the encounter goes on. Our first panelist is called Rémi Arsenault. He's works in housekeeping at the LaSalle hospital. He's with the union SCFP 281, and he's also a militant with Socialist Alternative. He's going to come talk to us about his work conditions as well as the mobilization situation at his hospital. So Rémi, there you are. Hello everyone, thank you Chantal for the presentation. I would also like to thank the organizers for this webinar. As Chantal just indicated, I am a militant for alternative socialists as well as a union representative. So to begin, there's a lot of things to talk about.
Mais tout d'abord, peut-être quelques mots sur le contexte actuellement.
A few words on the current context and for union organizers, for which union organizers need to adapt to. So first off, of course, the pandemic has been hitting the healthcare system fully. But let's talk quickly about the 2017 fusions. Healthcare establishment, union houses had to fuse together.
Qui sont dans une espèce de grosse bâtisse, un appareil administratif hyper compliqué pour obtenir les informations. Les Ciusss, maintenant, c'est ça, en fait.
He made a metaphor with asterisks and obelisks where the main characters are in a building and it's very difficult to relay information, as an imagery for how difficult it is right now for people to relay information to one another. And it makes the situation be such that it is incredibly difficult to work in CIUSSF. So people who work in kitchen, people who work in different fields, technical fields in the hospital, in both hospitals and old folks home. So this union represents a majority of women, which is also a difficulty because we know that women have a lot of extra, what we call the second task, so family responsibilities at home. So it's harder for them to participate in the union organizing at work. So these are, in a general way, the people that we represent. So Rémi's union went from 400 members to 8,000 in 3 years. So this is the sort of centralization that we were talking about, that we need to modify structures in order to reflect this new reality, because it's hard to make a relationship between the union representatives and the base because of that huge number of people represented in a single house.
C'est une chose que notre comité devrait travailler. C'est des confrères de travail qu'on a décidé de former un comité à
So in
l'hôpital.
order to face these difficulties, we've decided to form a action committee at LaSalle Hospital to discuss and look into the current negotiations. So despite the fusions that happened, we're trying to negotiate the best work contract possible for the employees. A lot of people are affected by COVID-19 pandemic, are more vulnerable than they were. We have done 3 activities since the beginning of 2020. The first one is distribution of a information pamphlet, and already that has its own difficulties. And on the pamphlet, we denounced the government's offer for salary proposals. A lot of the work concerning the information pamphlet was made alongside my comrade, Bruno Pierre Guimet from the Ciusss, who is also a union representative. Because what I want to talk to you about is the importance of inter-union work, sort of solidarity across different unions and conversations with each other and organization between each other. So it is essential that we do this. So we can build on that from this point on. So we have done this first action, and in this pamphlet, we invited members to talk about their own situations to Ciusss, the Minister of the Treasury for the government. So invite people to communicate with him directly. That was the first organized action, and it had a relatively good success rate. Rémi knows that he has colleagues that have actually sent emails and various communication methods to the Minister of the Treasury. The second action is to organize an action, but it was not possible because in the beginning of March, the pandemic happened. So unfortunately, the communication between the executive and the base members was difficult because the union executive had to face new challenges, specifically the battle concerning protection equipment, PPEs. At LaSalle Hospital, there was a shortage of masks at that time, and people working with patients had to work without proper protection. So it was definitely a challenge for people to work in these conditions. And many people working alongside us caught the virus and brought the virus to their families. And one specific case, the worker got the virus, brought it back home, and unfortunately her husband passed away due to that situation. And Manon Massé made a public declaration about this specific situation. The third activity is an attempt to organize a meeting outside, and Alternative Socialist was there alongside our workers outside in front of the hospital. It was a success. We were able to mobilize in 5 simultaneous hospitals: LaSalle, Douglas, Ciusss, Queen Mary. So we were able to relay information simultaneously and create contacts in other hospitals. It's difficult. We have to get out of our comfort zone. We have to talk to people who don't work directly with us, but we were able to rise up to the challenge. So it's important to solicit local help in organizing. So to conclude, this is what I wanted to talk about: to organize locally and in a manner that involves other unions. I also invite you to consult the Socialist Alternative website at alternativesocialiste.org in order to consult the articles talking about healthcare in which I was involved in the writing process, and also look at our political program concerning the COVID-19. So thank you very much, and thank you for being here. So Chantal responds that, so if I understand correctly, what's important is to inform the workers and to be there with them as the action is going on the ground. We will now talk to Carole, who is an asylum, a person who made a request for asylum. She works in a home for older individuals, and she works with the city who organize Centre de travail et travailleuses immigrants, which is a city. So it's like the centers for immigrant workers who organize today's panels. So she will come and share her experiences within our system as an asylum seeker. And it was not easy to go through what she went through. So we thank her and appreciate her presence here today.
Bonjour à tout le monde et bonjour à toute l'équipe.
Hello everyone, and hello to the whole team.
M'exprimer encore.
I thank you for letting me voice what I've been through. My name is Carole Benedicte Carole.
Étrangère et aussi.
I am a migrant worker, and I am requesting and seeking asylum. During the COVID-19 pandemic, I felt incredibly sad, and I wanted to voice that. So I tried to create a bit of commotion and test the government's program. Oh, I'm sorry, not create trouble, but rather postulate. So apply for various government programs to work in any place that would accept her, including the government program to work in old folks' home to help out. So she was recruited to do that. She was very much protected. She felt very protected. She doesn't quite understand how she caught the virus because of the level of protection that she had. To apply in the healthcare sector, it's difficult because they ask for her healthcare numbers, but the difficulty was that because of her immigrant status, she didn't have such a number, so we had her understand that she didn't have access to the services. And the first one didn't accept her to go to the hospital, but the second person she contacted asked her to go to the LaSalle hospital because she had symptoms. And so afterwards, she was recruited to be a worker for which is housekeeping as well, because she has a lot of experience in that, but she wanted to be working with the patients directly, but she couldn't because she was sick. So in order to get the contract, she needed to sign while being absent of all symptoms. But even she tried to be tested multiple times afterwards, she never got her test that proved that she was negative. So even if she did her stage to be a préposé aux bénéficiaires,
il me faut bien sûr m'occuper, payer mes charges.
She couldn't get in. And what hurt her even more,
sans papier qui travaillaient sûrement, je sais pas si c'était comme bénévolat comme moi ou pour être payé.
At that time, there were people in her situation, which is an asylum seeker, who worked for free, so who volunteered to help, who were equally exposed to the disease. So the government would let them be volunteers and work in there. But once it came to paying and hiring them, then it was unacceptable. And so today the government is trying to create a program to hire more people in those positions. She applied, but she's not sure that she will get access to that program. because she was sick and she didn't do the 120 hours that they are asking to get access to this program. But even if she has access to the program, a lot of asylum seekers will not have access to that program. So it was a demonstration of an extreme injustice.
Quand tu te retrouves dans notre situation, tu as cette volonté-là parce que nous, on le fait par amour.
When you are in this situation, you have this will to go through everything because we work for reasons of love. We love the work and we want to help people. And even if I have all the studies required and even if I have experience, they would not accept my application. It's a job that requires compassion, which demonstrates that we have compassion as workers, that we want to work for the betterment of others, of humanity. We need to be empathetic and sensitive, and we need to love what we do. But are we recognized as workers? I do not think so. So this pride that we are asking, we are not getting. As an asylum seeker, as a volunteer, if I wasn't in the CTI, the organization that organizes this talk, I would not have had access to healthcare services. So these services are extremely important for people who are asylum seekers. Because some people are sick but are not included in our healthcare system, and we do not have a solution for them. So it got incredibly complicated to get access to information required to get access to our healthcare system. And so I wanted to share with you today the sorts of somersaults that I had to do because of this system that we are facing. Thank you very much, everybody.
Partager ton expérience.
Thank you, Carole, for having shared your experience. Carole talked about a problem that we often find in our society. She's part of numerous workers who are requesting asylum, and the government, specifically the Legault government, said that even if they are working, even if they fell sick helping our population, we are not going to make it easier for them to access permanent residency status. And so we need to work together to help these people who are seeking asylum get justice for their situation. We will now go to our third guest. It is a pre-recorded message, so it's a little bit longer. So Jane is the person who will give her testimony. It is not her real name. She has arrived a short time ago to Quebec, and so her real name is not disclosed because of vulnerability purposes about her status. But we believe that her testimony will be extremely important to today's conversation. And so I will now let the video play out, and thank you very much. And I do not hear anything right now, so let me message the moderators. So we are waiting to figure out the audio of this video before we can play it.
il semble qu'on a un petit souci pour le moment avec le son, mais ne vous en
It
faites
would
pas.
appear that we have a issue with the audio, but we will rectify it shortly. All right, we have some audio. I cannot hear what is being said right now. So there seems to be more difficulties with the audio.
On a Jane, donc une travailleuse à domicile pour partager ses expériences. So hello everyone, we have today Jane to share her experience as a caregiver. Mais il faut noter que son nom, ce n'est pas son vrai nom. Jane, ça c'est un nom fictif. But you have to note that Jane is not her real name, it's a fictional name. Alors, on va commencer avec une simple question. Donc, Jane, est-ce que vous pouvez vous présenter vous-même? So we're going to start with the basic question. So, Jane, can you introduce yourself?
I'm Jane. I'm a living caregiver. I'm on the work permit. I'm from Philippines and I came here in December 2020. I'm 19, so.
Okay, no problem. Donc, Moi, je m'appelle Jane, je suis aide familiale résident et je travaille avec un permis de travail. Je suis venu en décembre 2019 de Philippines. Okay, merci. Ensuite, est-ce que vous pouvez présenter votre travail et aussi les conditions de travail? Qu'est-ce que vous faites et quelles sont les conditions? So, Jane, can you tell us about your work and working conditions?
My main task here is to look after the kids. Yeah, bring them outside, play with them. Then is the cooking, cleaning, and doing all the housework and laundry.
Okay, thank you. Donc, ma tâche principale, ça c'est s'occuper des enfants. Et je dois être avec eux à la maison ou quelquefois à l'extérieur. Et aussi, je fais la cuisine, aussi vaisselle, lessive et d'autres types d'entretien ménager. Donc, et combien d'heures vous travaillez? So, how many hours do you work?
In a day, I work for 11.5 or 12 hours a day. So in 5 days, I work for 56 hours.
Donc, par jour, je travaille à peu près 11h30 ou 12h de lundi à vendredi. Donc, ça fait à peu près 50.
If you need me to like relay the information because you can't hear clearly, just let me know in the chat. My name is Simon. You can just send me a personalized chat and I'll relay the information as I hear it.
So for your working schedule, can you plan by yourself the schedule or is it inclusive by the employer?
Sometimes they give me earlier notice what's going to be the plan for the next day. Sometimes they ask me what I can do for the next week or the next day. So I also make a plan. Yeah, they all allow me to make a plan where to take the kids.
Okay, donc de temps à autre, l'employeur me demande mon plan pour le lendemain ou la semaine suivante pour planifier un petit peu. Et vous habitez chez l'employeur, so do you live in the employer's house?
Yeah, since the pandemic started, I stayed with them, I lived with them towards March up to now.
Donc, depuis l'éclatement de la pandémie, donc de mars jusqu'ici, j'habite chez l'employeur. Donc, dans ce cas, avant la pandémie, donc vous habitez à l'extérieur de chez l'employeur. So before the pandemic, did you live outside of the employer's house?
Yeah, I live in my own place.
Galaxy A10, can you hear me when I speak? Oh, does that mean that you cannot hear the original video at all? Well, all right, I'll relay the information. I'm sorry, I thought you could hear the original video, which is in English right now. All right. So we're talking to a woman who is a housekeeper, has been in Quebec for 3 years, and her work conditions currently is that she works 11 hours a day and lives in her employer's house, and she cannot get out of her house. And I'll continue to translate as she continues. Thank you for letting me know, by the way. Sometimes I speak with my employer to adjust something, but it is not easy because I never know if my demand is acceptable for the employer, and I do not want to be penalized. Could you talk about your working conditions and overall level of security at your workplace?
So can you explain about your health and safety conditions in your workplace? So
yeah, can you talk about your health and safety conditions at your workplace? Are you facing a specific risk right now of injury or sickness?
and the stress level is high, and I probably, yeah.
Yeah, and I'm also just waiting for her to finish speaking before I translate because I can't clearly hear what she's saying. There are no large health issues, but there's a high level of stress, and I'm often very tired. Thank you very much. So in this case, can you give us a bit more detail about your the process to get your permanent residency in Canada?
My relatives find an agent for me, and the agent is based here in Canada. So he find an employer for me.
Again, I'm going to wait for him to simply say it in French so I can translate because I cannot hear her clearly. Her aunt recommended her to do business with an agency. So this agency helped her find work here. She was asked to fill out certain documents, which she did. And she had to pay for these documents, large amounts of money, specifically for medical testing that are not cheap in certain countries where healthcare is, of course, not public and free. This agency is based in Canada. Before coming to Quebec, had you occupied a similar work title? Did you ever work as a homekeeper in another country? Yes. She worked in Singapore previously? She worked in Singapore again. What did you do in Singapore and for how long? She worked in Singapore for 15 years.
Et ensuite, après votre travail comme un travail migrant,
after you work as a migrant worker, do you have plans to more fully move to Canada with your family? Settling down in Quebec and Canada? Yes, if she has the opportunity to do so, if she can, she would like to stay here. And to do that, are there obstacles or difficulties that are keeping you from settling down here in a more permanent manner? So now she's not facing any obvious obstacles? And she's hoping that the government of Canada helps her fulfill her dreams of staying here. So she thanks her government for giving her the opportunity. Are there any other specific difficulties that you would like to share with us? Things that you might benefit from our support, things that we might be able to work together on? Or any other message that you might want to share with the people listening today? Yes, she would like her overtime to be recognized as such and paid. So yeah, oftentimes she works longer hours than what is on her contract, and she is not paid for these hours or they are not recognized. And the agency who helped her get the job cannot help her get the money from this overtime.
c'est illégal. Okay. Merci beaucoup, Jean.
Thank you very much, Jean.
So is there anything that you want to add?
Is there anything you'd like to add?
That's all. Yeah.
That's all. Thank you.
Okay. Donc, c'est tout. Donc, merci beaucoup, Jean.
Thank you, Jean,
Jane, for sharing your precious time.
to share her time and story.
Okay, thank you.
Merci beaucoup pour
Thank you
témoignage.
for this testimony.
Je veux transmettre nos remerciements à Jane d'avoir pris le temps de témoigner. La situation
Chalky, if you would please extend our thanks
particulièrement difficile, l'organisation est
to healthcare workers because it's particularly difficult right now with work conditions,
particulièrement pénible et de très très longues heures de travail.
very long hours.
Donc c'est important de permettre
It's important to let
de s'exprimer et de
people,
témoigner,
these workers, to
pouvoir
tell their
aider
stories
à se mobiliser
so that we can mobilize on these issues
pour contribuer à améliorer leur
and
situation.
contribute what we can to benefit
Sans plus tarder, je vais céder la parole à Alain Croteau.
their situation. So now we will talk to Alain Croteau.
Ciusss du Centre-Sud.
He is the president of STT Ciusss Centre-Sud. It's a very large union.
Alain représente particulièrement la catégorie 2, c'est-à-dire
Alain represents category 2.
le personnel d'entretien du service alimentaire, de la
So,
les ouvriers spécialisés, un peu en fait la
specialized worker, people who clean clothes, people who work in the kitchens, people who work with older folks. And he will talk about how working conditions that were already difficult before the pandemic are now even worse. So, Alain, please go ahead. The testimony of Jane and Carole speak to a larger phenomenon for these workers, these female workers, this systemic discrimination, and there's a ghettoization of the workplace that is present even in the public sector. So it's no longer only the private sector that operates on the principle of exploitation. It's also the government, the Legault government, especially with this position on systemic racism. So the people who work directly with patients right now are oftentimes racialized worker and immigrant workers. So we're flat out talking about people of color, not directly about immigration, just a population that is overly represented in those bottom of the ladder positions in the hospital. And so we can see that as an example of systemic discrimination because these lower positions are overly occupied by racialized workers, as opposed to higher positions, quote unquote, higher positions that are occupied by white workers. And so we have systemic discrimination in the workplace. So we must challenge employers in front of the courts and unions from our perspective at the top. We often talk about like work discrepancies, salary discrepancies, but what we're actually talking about is ghettoization of the workplace. So there's a huge amount of work to do. Work of education to talk about systemic discrimination in the healthcare sector, in housing, in work, in the police sector. But it's a chain that just each part hooks into the next. And it's grand time for unions to realize the size of the problem, the size of the kind of conversation that we must have.
Et je vous dirais qu'on a une proportion de femmes racisées d'environ 70%.
Where the presenter works, the workers are racialized to a 70% extent, to the extent of 70% of the workplace.
Imaginez maintenant si on s'en va dans les résidences de personnes autonomes qui ne sont pas soumises aux conventions nationales.
So he works in a public healthcare institution, but if you imagine a privatized sector job, then the salary lowers, the protections lowers, so the exploitations of racialized workers is even higher in these privatized, ununionized workplaces. And in the unions, we see an underrepresentation of racialized persons, even though in the workplace they are the highest to be exploited. So one of the solutions would be to have an imposed quota to have people of color in the union executive teams.
À l'échelle de ce qu'elle représente dans la population.
So how much should we pay these racialized workers? $26 is the proposal of a businessman. Now, our proposal will reflect the fact that we must fight discrimination and poverty and other kinds of injustices. So these are the messages I wanted to break today. Thank you, Alain, to bring to us the role of large union houses of what they should be doing and not to stay immobile towards the political situation that is institutionalized racism. We will now talk to Marie-Hélène. Marie-Hélène is a teacher to social workers, and so she will talk about how cares should be shared in a mixed social setting. So what we have here previously, we can understand the breadth of the difficulty in our society, how this healthcare work is split up in multiple specific groups of workers with specific problems and work conditions and salaries. And within all these groups, there's a hierarchy and situations of oppression and exploitation. There is a devaluing at a systematic level of specific works that have very little value that we could give to workers that were female, that were racialized, that were migrants, because the work was undervalued. But the crisis also gives us specific hopes. For instance, there are women in different workplaces that are taking the opportunity to express themselves and give voice to their struggle that is more present now in the
physiques, il y a des exigences émotionnelles, il y a des
so this work
qui demandent un certain nombre
an emotional aspect, but also a physical
et qui
aspect.
sont systématiquement niés parce qu'on le ramène toujours au travail que font les femmes.
Work that is required, we are denying that this work is taking place because the work is associated with the triple task, so work that women do at home for free. So this work being done in the healthcare system is devalued because it's done by people in general with no training and on a daily basis. So it's enough to be considered these like guardian angels. We are also workers. We must get paid, we must get respected, because we are in a logic of a government that is a bunch of accountants, of small business leaders. So facing this logic is a huge challenge, especially in the context where the government is trying to get the economy roaring again. So this work has to be recognized at a wider level. But even if we see more workers coming forward with their stories, there are still a lot that are invisibilized. For example, workers that we've heard today tell their stories. So we have not heard everyone's stories. To end, we must foster alliances between different groups of workers, and even if they have specific conditions, they have a shared destiny in the healthcare system, so to speak, where we have similar goals and we should all get recognized for the work that we do, and so we should work together to achieve that recognition and respect. Thank you, Marie-Hélène. Marie-Hélène spoke a very important element, which is to create alliances between different working groups, different unions. That solidarity is very important. There are various groups that have been created on Facebook to support these different struggles and to talk about how to mobilize on the ground. So Rémi has a bit of information on the subject matter of on-the-ground mobilization on Facebook. So if you need more information, talk to Rémi. He will help you out to find out which group, which space is best fitted for on-the-ground mobilization. If you have questions, you can use the chat for everyone. Or if you cannot type, just write your name and we'll give you a speaking time. I would like to underline the panel was organized by our coalition. Then this coalition has signed a common declaration for a minimum salary of minimum $15 an hour. It's more than time that everyone get this minimum salary, $13.10 an hour to take care of people. It is insufficient, and it does not enable people to get out of poverty. So it is very important to have a decent salary for everybody. We still see it. We see it especially in this pandemic time, where invisibilized workers are suffering the most. So we must recognize them to their just value, the value that they add to the society. The special deals that the government have passed have been all over the place. There's horror stories where workers are late by 5 minutes and they lose their entirety of their $1,000 special deal. So it is essential to mobilize ourselves to work together. And it is through worker solidarity that we will achieve gains for the working class. We also invite you to invite the group that has made this declaration. It is called Déclaration Commune, Common Declaration on Facebook. And we organized today's webinar. We will organize others as well. In the coalition, there is the regional commission of the FTQ of Regional Montreal. The president is there today. There's also the Central Council for the CSM, of which Chantal is part of the executive. And Ramadi is also saying hi. She's the treasurer for the Central Council, Conseil Central. So Rama is there. Hello, Rama. There's a CTI, where Chalky is a member of it there. And there's a lot of people today that are working with the CDI that are not specifically named, and there's others that we are forgetting, but we thank for doing the work of having an appropriate pay for appropriate work. While Chantal was talking, she received a question. So she's asking who could answer. So the question is about, perhaps the problem is that in healthcare we have the need for the services of agencies. So maybe the problem concerns agencies. Oh yes, of course, Frédéric Collin is Frédéric is also an executive for the regional committee of the FTQ. So we forgot, Fred, let's just quickly mention it. So the question is whether or not at the base the problem might be the utilization of agencies. Would anybody be able to answer this question? So would one of our panelists be able to answer this question? Carole will answer. For Carole, the problem is way more a problem of discrimination because these agencies work with people with no status or precarious situations. So the discrimination is valued. Why? What she observed at agencies is by working there for 2 years, what you notice is that you don't have the same rights as everyone else. If we must give you the security material, you will not have the same material as everyone else. You will not have the same access to security equipment as everyone else. So you will not be protected as everyone else. But and to keep your position, you have to make less money and to work 3 times as hard as everyone else. Because you have no work security. The agency can send you packing, can fire you by clicking their fingers. It's very easy to get fired under agencies. So agencies exploit discrimination that already exists in our society to make their profits.
Tous les travailleurs, mais qu'est-ce qu'ils font? Ils créent une discrimination ouverte et pour montrer aux autres personnes que vous n'êtes pas des nôtres, quel qu'en soit ce que vous fassiez.
So agencies contribute to creating this feeling to tell people migrating that they are not part of wider Quebec society, that they are not like the rest of us. And Legault put oil on the fire when he said that when it came to the government's program to work in the healthcare industry, only residents and citizens could apply. So even if migrant workers volunteered and worked, they were not included in the declaration of Legault. So migrant workers are doing this work not because of the pandemic, but because they chose to do so, because they care. So Legault encouraged citizens and residents to do that work and augmented salaries at the same time, but not for migrant workers. So agencies contribute woefully in the discrimination of workers. Thank you, Carole. Julien has a commentary to make, has a comment to make. Thank you, everyone, for your comments. It was very interesting. Julien had the opportunity to participate with Rémi to last Friday's action, where everyone was outside. And Julien was very happy to see that everyone from the base was on the ground and being militant. So people got out of the hospital to see everyone and meet up and talk, which was very encouraging. One of the things being fought for was access to security equipment as well as salaries. What Julien would like to talk about is the access to salaries and alliances and inter-union work that was talked about numerously during today's meeting. A few years ago, there was a campaign that coalesced many different unions. Now, of course, it's been 5 years, and it was a $50 campaign. And back then, it was the correct salary. But today, what's happening is that there was a special deal with the government, whereas the more risk you had at work, the more money you could get. And that happened in many different sectors of the economy. But now what happened is that a lot of employees are saying that, oh, the COVID-19 thing is over, so we can just remove these extra dollars an hour for these employees. So Julien is asking that would there not be a request, something to fight on, where these special dollar deals that people got because of risk should be taken to be something that stays in the long term as the salary of people from now on, because they are so important to the economy.
J'essayais de laisser la parole à nos...
Marc-Edouard will answer. He wanted to let the panelists answer. but now he will answer himself. So Julien, him, and Marc-Edouard don't know each other, but at FTQ, the principle is that, yes, we should keep these dollar bonuses, but now we find a problematic of ideological and application problem. And this is what the Legault government doesn't understand. The real struggle is going to be there. Carole explained it clearly. The way discrimination is exemplified on the ground, but the unions, they fight for the principle of relativity, wage relativity. So bonuses are good and we should keep them, but union houses will not agree to invisibilize entire sectors of the workforce that did not get bonuses, that the government does not consider to be worthy of bonuses. So the unions don't want to make a small proportion of their workers be winners while the rest of the unions doesn't benefit or doesn't win anything.
C'est là, je pense, la bataille que nous
So this is where the struggle is going to happen within the unions. So they don't want to like have an unequal treatment of their members. Is there anyone amongst the workers today in this meeting that would have a comment to make vis-à-vis this situation? So Rémi would like to respond to this question, specifically about salaries. Well, from the beginning of the negotiations at the FTQ, F3 CSN, they wanted to focus on lower salaried workers. And there's two different strategies at the CSN. They either want a fixed amount, or the FTQ, it was a little bit more complicated. They wanted to augment the salary by 4.1%, and the lower salary by a little bit more, but he struggles to explain it. But it's been a struggle for a long time. The pandemic has come to like muddle the waters a bit, especially with the bonuses. So what we don't like about the bonuses is that it won't be on our pensions. It's not calculated in the pensions of employees. So Rémi is arguing that what the unions are fighting for concerning salaries was already appropriate, so we should continue to fight for that. I think Croteau has a comment to make. So what he's saying is that it's very difficult to negotiate these days. People on the ground probably noticed it. We have a government that's a businessman that doesn't really respect collective conventions. So the current negotiations are very, very difficult. Alain used the word fiasco to describe them. At the Ciusss Centre-South, they have more housekeeping employees than patient workers. Sorry, I don't have the translation for specific work titles. So Legault is not measuring the consequences of what he's proposing in terms of solutions. And it's very obvious that none of what he's proposing is going to work on the ground. Carole agrees to keep the bonuses, but Carole is also for the $15 an hour, which should already be one, because she knows Carole works for free because she's in her stage, but she has a lot of co-workers who are minimum wage and are in situations of poverty, who do not have access to normal employment except through these placement agencies. So there's no way of getting a good salary because these placement agencies don't give the opportunity for that. So under the current system, under the current government, they're putting on the ground a form of slavery by blinding the common citizen. So we're just trying to hide what is actually happening under our system. So what the government is saying is that it's okay to be a slave here because you might have future opportunities. So the $15 an hour will not make us rich, but it will give us the ability at least to be able to live. Because right now with working agencies, people who
have
statuses, work statuses, it's impossible to make a living right now. At least with $15. But right now we prefer to ignore these low-paid workers. We don't want to make them legal. We don't want to accept them. We want to fire them at the first sign. We want to pay them as little as possible. And this is the reality that we have on the ground. And some of us work for $10 an hour, and it is not enough to even be at the poverty line. So it is a form of slavery in our society. Some of them even work for $8 an hour. And one way to fight is to tell the common citizen the truth about what is going on, to call it slavery, that it is unacceptable, to have that in our society, and it is unacceptable that people might accept it by ignorance, from ignorance. So we should educate people. We have a last question from Carole, and the question is, how do we integrate the private sector into this?
Comment on intègre le privé, les aides à domicile? Donc, c'est important de booster le salaire minimum pour pousser les salaires vers le haut. N'y a-t-il pas aussi un ensemble de métiers essentiels à revaloriser?
Isn't there also an old group of work titles that need to be revalorized, or revalued, I should say? So there's 3 questions in this question. Yeah, it's a large question. So basically, how can unions support like bettering of work conditions for work places that are private and not unionized? And Alain will try to answer. So the problem is that the person that must understand is always the last to understand. So the unions will be the last one to understand in the current situation. Systemic discrimination is known within fields of law and is known within different fields of society, but it's as if there's a lack of will or consideration from unions to not take it seriously.
De ces problèmes de racisme et de discrimination-là. Et j'espère que...
So Alain hopes that even if we should not, use tragedies as political leverage, that at least the current situation will give us the momentum to face some of these issues. But it's difficult for the executives of unions to get involved, but they should. The CSN, FTQ, and FIC, they should definitely take part in the fight against systemic discrimination. But it's difficult. And if we don't, then it becomes a form of exploitation that never ends, that, becomes what Nicole has described earlier.
Qui s'adresse peut-être plus particulièrement à Rémi, Alain ou Marie-Hélène. Donc, en
So in the response of the mishandling of the CAQ, the CAC, can we prepare the September going back to normal via inter-union work? Marie-Hélène will answer. She would like to bring the focal point on the workers that are not unionized under classic unions. For example, the agency workers, service workers. I think we have to look at this as if we see it as an iceberg. We only see a part of workers that we shed light on with the media, where it's an emergency, but we also have to take the time to go see workers that are not unionized, and we must also work to improve their working conditions. So when we want to improve working conditions, it's for everybody. So we must keep that in mind.
Merci Marie-Hélène. Est-ce que Alain ou Rémi, vous auriez des idées ou des... Rémi?
Oui, ben,
Rémi has an idea.
En fait, c'est toujours été un défi aussi de
It's always been a challenge to unite all the union houses under a single front. It's always difficult. People usually work in silos. To be ready in September, it has to be the ground workers, not the ground workers, but the base, the common worker, the worker on the floor. There you go. That organize the struggle. Inter-union groups that have to organize a common front. Because unions can work together, because unions all defend low-wage workers. So for Rémi, to get unions closer together, it must come from the base, at a local focus, for people to talk to each other. It's important for people to talk to each other, sorry. Alain says the same thing, but comes back also, wants to talk about ununionized workers and agency workers. And even in hospitals,
des PAB qui sont éducatrices spécialisées que l'employeur laissera difficilement passer d'une catégorie à l'autre. Il y a plein de freins.
Okay, so Alain is explaining how complicated it is sometimes for one title in one job place to transfer to another work title.
Le monde syndical a un mot à dire dans cette façon de procéder-là, ne serait-ce que peut-être en travaillant sur des ratios qui sont inexistants. Et le fait qu'on a toujours...
So Alain brings back again the idea of ratios.
Permettait du non-remplacement et entre autres permettait le recours justement aux agences qui ne pourraient se justifier.
And he points out that one of the problems on the ground is that the management of hospital workers is done in such a way that it requires the use of agencies, which creates the problem in the first place. So we should have ratios and quotas of healthcare workers on the ground so that we don't need to use these agencies. Alain is currently laughing at the idea that Legault is going to train all these different healthcare workers because they were not enough workers before the crisis, and so now to think that it's going to be even more is a pipe dream. Makado is going to talk about systemic discrimination because he's very passionate about the subject. Seeing the impacts on the ground of this discrimination. The only comments that he wants to make is, and he would like to have this exchange between each other. He thinks we're the right space for this. We heard about the very, very low salaries, the precarious positions of people without legal status. He wanted to cite my noon, who was quoted by Madame Ciusss, we have to stop talking about simply obstacles. We must talk about results. We must talk about what needs to happen. We know there's obstacles to racialized workers. And he was thinking about Carole's testimony, and it's absolutely unacceptable because what we talk about the least is that when we keep someone in a state of slavery, modern slavery, what we're actually doing literally is the citizenship access doesn't exist anymore. And so he's talking about a secure work, to propriety, to leisure, and all these different aspects of being a citizen is removed, is taken away. So the minimum salary is the beginning, but we must not stop there, because the goal is to get these people who are exploited to the finish line. Because right now people don't get to the finish line. We don't let them get to the finish line. So even if we remove a few obstacles, there's still a bunch of obstacles on the way. So he would like for us to think about the obligation of results. So not only in terms of employing, but in terms of quality of life, of citizenship, of living here. He's speaking out long.
Oui, j'aimerais ça intervenir.
Rama would like to intervene. Thank you, Marc. So we will now talk to Rama. Rama has comments to make about what was just said.
Tout à fait. Merci beaucoup pour ce webinaire. Je trouve que le forum est vraiment bien parce que je suis contente d'entendre les gens qui sont sur le terrain, les gens qui vivent la discrimination. Alors moi, je vais revenir sur quelque chose qu'on vient de nommer qui est vraiment, je pense que le centre et qui sera un sujet avec lequel on devait tous se mettre d'accord pour combattre, c'est les agences de placement. Les agences de placement créent ici deux catégories de citoyens dans une société. On accepte qu'on les exploite, on a parlé tantôt de l'exploitation, on a parlé de l'esclavage même des temps modernes, et on les laisse continuer à payer des gens qui font le même travail que toutes les autres personnes, mais à moindre coût. Parce que là, les agences de placement, l'employeur qui est le donneur de job, se désorganise, puis en même temps, se déresponsabilise en disant que c'est l'agence qui est responsable de la personne. Et ça, je vais attirer votre attention pour dire quand même qu'il y a une loi qui devrait normalement encadrer les agences de placement, mais vu qu'on a un premier ministre qui n'est pas conscient de tout ce qui se passe actuellement, nous, on devrait vraiment, en tant que syndicat, pousser dans ce sens-là pour qu'on reconnaisse, qu'on encadre les agences de placement. Si on pouvait les éliminer, mais quelque chose que je sais qu'on ne pourra pas faire. Actuellement, le lobby est tellement fort à Montréal-Nord que je vais même vous attirer votre attention pour dire qu'il passe par nos compatriotes. Quand tu es haïtienne, quand tu es africaine, quand tu es quelqu'un qui a une communauté ici racisée, on passe par toi pour que tu ailles voir ta communauté pour qu'ils puissent les recruter. Alors ça, il faut faire beaucoup attention avec ça parce que nos compatriotes viennent nous vanter l'importance de travailler avec une agence alors que l'agence ici vient exploiter les gens. Mais j'attire une autre fois votre attention. C'est que des fois, ces préposés là où ces personnes racisées viennent déposer leur CV dans les Ciusss, où par exemple, ces personnes pourront trouver un salaire décent, mais les gens dans les Ciusss qui donnent de l'emploi les refusent, fait que là, les agences les prennent puis les ramènent par une autre porte de sortie. Alors ça, c'est la personne a déposé son CV, le Ciusss a refusé, l'agence le prend puis le ramène d'une autre façon, sans encadrement, sans formation. On l'a vu, qu'est-ce qu'ils ont fait avec les demandeurs d'asile. Ils les ont jetés dans la bouche, dans la gueule du lion en disant « Allez-y, sans protection ni rien ». Alors, avec tout ce que vous avez dit aujourd'hui, moi, je pense qu'on a quand même là un sujet commun qui devrait nous rassembler tous pour dire ça par sens, les agences de placement. Les agences de placement n'ont pas de place là, et s'ils sont là parce qu'on ne peut pas les éliminer pour le moment, il faudrait les encadrer, qu'il y ait un permis. N'importe quel Joe bleu aujourd'hui est capable d'ouvrir une agence de placement pour aller chercher les Noirs, les gens qui ne connaissent pas bien leurs droits pour venir travailler. Alors, dans ce sens-là, je remercie les organisations comme le CTI, par échelle, plusieurs organisations, mais je remercie la FTQ, la CSN aussi, qui encadre et qui accompagne ces organisations-là. C'est quelque chose qu'on devrait vraiment, à la sortie de cette crise, mettre de l'avant et encadrer. Parce qu'on a vu, je vous le dis, le Premier ministre du Canada a donné le PCU à $2000. Quelqu'un... Là, on devrait se servir de ça pour dire ça n'a pas de sens de travailler à $12 de l'heure.
So it's even more unacceptable that people make $10 an hour, $8 an hour, $12 an hour. So we have the leverage now, so we have to go forward. We should go forward and win. Thank you, Rama. We have gone longer than our allotted time for the webinar. So because of the importance of what we're talking about today, we have talked about many essential things, many important things. So Chantal is going to make a more personal call. If you're unionized, get involved in your unions. Put pressure on your union executives if they're not fighting enough to fight against lower salaries, bad working conditions, and workplace discrimination. It's everyone's issue. If you're not unionized, you can work with the CTI, with the Socialist Alternative, and other groups, and all these groups are there to defend workers' rights. And also, if you're not unionized, don't hesitate to contact union houses that will help you unionize your workplace, because it remains an essential condition of workplace higher work conditions. Sorry about that. So Chantal is thanking everyone, specifically the panelists, checking. And as you can see in the chat, there are links there to get involved. Chantal is thanking me. I just made a joke. Yeah, we're sharing various information in the chat. So please go and like these Facebook pages to get involved. And don't hesitate to come work with us. We're here, we're not going to give up. And we need as much help as possible. Thank you, everyone. And that will complete my translation, I believe, for today. So thank you for listening. And yeah, if you want to get involved, you can also just talk to me personally. Write to me.